First motion is Betty would like to participate via phone. Is there Member Daly? Member Coates? Any questions about that? All those in favor? Aye. All those opposed? Ayes have it. Next is the approval of minutes. Member Salzer? There are no minutes. That's why I was getting ahead of myself. We're going to move some things around for the sake of trying to, I'm going to move public comment up to the beginning of the meeting. Is there public comment? Seeing none. Go into informational items. We'll move to receive and file everything on that, but we are lucky to have Tim and Mary to give us their report today for the RJE Steering Committee, and thank you for all your time. So unless I see anything on the other things, we'll just move to receive and file those, and with seeing nothing, I will turn the floor over to Tim and Mary.
All right. Hello. Oh, well, good afternoon. So, as mentioned by Chairman Dillon, thank you for allowing us to come and present on the Joint Commission on Racial Justice and Equity. We are in our third year. This is our second report, which is required by the charter. I don't know that I need to introduce again, but just in case, I'm Mary Peterson. So, as you recall, this Joint Commission was started in 2002 and 1, based on some things that were transpiring across the country as well as that was transpiring here in Peoria County. We formalized in July, and we began working on what was our mission was to look at Peoria County and make the determination whether there was racial disparities. In our first report, we did provide that to you, and it was overwhelmingly showing that there were racial disparities in all areas of our commission. We have 8 working groups, which now in terms of the charter, we changed it from subcommittees to working groups to be more effective and efficient. We have the steering committee, child and youth development, economic development and jobs, environment and climate, health and human services, quality housing. It says housing, but it's about quality housing, information and technology, the justice system, and transportation and mobility. We talked about in last time, and you will see in our report that we develop a 4-part plan to determine and to work on developing strategies to address the disparities that we found. The first was to create not a data plan, but to show, using data to show whether there were disparities or not. That was in our 2022 report. Many of you saw that, and again, we wanted to make sure that it was numerical. Next, working on creating a high level of strategies to address the disparities. And then next would be to implement those strategies and then to monitor and adjust. Developing the strategies, we've worked on that in the 2023 report. We still have more work to do. Implementing those strategies, we'll talk a little bit about some of those things that we are in the process of implementing. And then monitoring, continuous improvement is always a part of what any organization or group should be doing. So again, working with the city and the county, we've been able to get input from citizens as well as the county and government, city and county government. In our 22 annual report, and keep in mind, when we started the Joint Commission on Racial Justice and Equity, we had a big launching meeting, and then the Disaster Act was implemented, and we had to pivot, and we went basically not being able to meet in person, and we were meeting via Zoom. It brought an opportunity for people to come together and meet in some instances where they're not able to meet because of just time constraints. But in others, it presented some issues in that technology. When we talk about technology, and we'll talk about that a little bit later, everyone was not up to speed on being able to utilize technology to be able to be a part of those meetings and to provide their input. Some of the things in the last report we found disparities in was life expectancy, income, net worth, home ownership, vehicle ownership, educational attainment, involvement with the justice system, access to technology, and then environmental climate. These disparities were across the board, and the data we obtained from very reliable sources. We used the census, we used the EPA. We wanted to make sure that what we were what we were reporting was supported by data, that being quantitative data. Now we're going to begin to look at the qualitative data, or we're in the process of looking at the qualitative data to support what's quantitative. Tim, you want to talk about the 2023 report?
So we're here today to present you the 2023 report. Each of you I know has a copy. We're going to do it at kind of a high-level basis, understanding that the time limitations that are upon us. Our 2023 report does not rehash the findings of 2022. That's on record and it's there. There's no reason to get back into it again. What instead we've begun to look at is what are the strategies we're going to employ will be and how we're developing and building those strategies out. Mary and I are going to go through and talk, take turns going back and forth talking about our 8 subcommittees. But let's start off with the steering committee. I do think, I should say, true progress, I think, has been made by most of our subcommittees. Some have not made as much progress, frankly, as we would have liked. We're working with them to try and beef up their game a little bit as well. But true progress, I think, has been made. So let's talk about the steering committee first. Our activities during the past year have been to try and make our operation more efficient across the board. We presented to you some charter revisions, which you and the city both approved, created our work groups from the original subcommittees that we had. We created a liaison position between the steering committee and each of our subcommittees, and the intent being that we would have better communication and interaction between both. We created our onboarding procedure. We had our second annual meeting at the Civic Center. By the way, we'll have a third annual meeting later this summer. All of you obviously would be invited to that, and I hope you would attend. We also conducted a number of community engagement forums. Now, we've done those in the city. Our next one is going to be in August or September. We're working on dates right now. It will be at the Alpha Park Library if we can secure space there. We want to hear from people outside the city as well as people within the city. The first 2 community engagement forums we had were well attended. I think we learned a lot. It also served, I think, to underscore some of the things that we also already thought were issues, such as transportation problems for people to get to work, child care issues, and the like. Now, we also sought to build out a better website, social media presence, and that continues on. So for 2024, what we're looking at doing is continuing to assist our work groups to assure development of stronger strategies. We have an obligation per the charter to review proposed strategies of our work groups and to present approved strategies to the county and city. I think you'll actually get one maybe next month from one of our groups. I'll talk about that later. We want to continue to build a relationship with city and county governments. And let me say while I'm there that our working relationship with Scott has been marvelous. He's been very responsive to things we've requested, and I really want to compliment him, and also your DEI officer, Andre Allen, who's just been outstanding as well. We're going to conduct additional community forums to obtain qualitative data from the entire county. We're strengthening our work groups through continuing to add members to them and creating leadership, ongoing leadership training for those groups. We established a transition plan for terming out those who have served in a certain position for an extended period. For example, Mary and I will transition out to other positions, and we'll have new leaders of the steering committee by the end of this year. and as I said, building out a communications plan. Let me now turn to talk about our economic development and jobs work group. In 2023, they developed a pilot program to provide traditional financial support for transportation to selected graduates of ICC's Workplace Equity Program. And they also surveyed minority businesses and growth challenges. That led to a program that they're implementing this year that we're really very excited about. They're implementing with the city a pilot transportation project and working on scaling it up for the future. They're starting with a set number of dollars with hope that it'll build for the future. They're interviewing, and I think have already at this point selected a number of grads from the ICC Workforce Equity Program to do this transportation pilot with. And I think that by the time we next see you, by the time that we make our next report, you'll have information about that. Frankly, we were surprised about the transportation problems of people getting to and from jobs. They're also looking at possibilities for doing a pilot program in the child care area, and they're looking to evaluate barriers to minority business growth, which is a huge problem. It was a subject of discussion during some of our community forums. Mary?
And Tim, if I just might add, the Workforce Equity Initiative Program, they're looking at those individuals who have certificates in manufacturing as well as healthcare. And many of the positions that they're able to obtain are in outlying areas outside of Peoria. So again, making that transportation an issue for many of them to be able to get to work to those in those places of employment that are providing them with a living wage. That's part of the Workforce Equity Initiative Program. So I want to talk about environment and climate. As you may know, with the CO2 pipeline, that particular work group looked at where they were wanting to run the pipeline, which was in the south side of Peoria, which is already a disenfranchised area, and they asked the city to put a moratorium on approving any of those efforts until the federal government has approved more regulations. And so that was approved by the steering committee, then sent to the city, and then that was approved. This upcoming year, they worked with the city to talk about the distillery tip district and some of the funding, and wanted to have language in there that would lend to it a lens looking at equity, making sure that anything that is done, it has an equity lens on it. And so they were able to do that, and some of the language was changed in there to make sure that as they move forward, that there's an equity lens on it. Other things that they're going to be working on in 2024 is looking at asthma, lead, and brownfield issues, especially and working with other work groups that are tied to those issues as well.
All right, Health and Human Services. This is a group that has been active from our early days and came to a strategy early on. That strategy focused around trying to create a health equity component into the planning that goes on for healthcare in our community. And they discussed with the Partnership for a Healthy Community the concept of formalizing within their committees a specific health equity structure to do that. That has progressed, I think, quite well. And now that we're about to enter another China chip schedule, now China chip has nothing to do with the country of China. It has nothing to do with silicon chips. Instead, I suspect all of you know it has to do with our community health, community health action. And we're getting into another formal planning for the session for that. And what we're going to be looking at again is how we can better build out within that an equity lens to provide perspective and process assessment at critical touch points within the community's health programming. We've worked, that committee has worked with the County Health Department. Again, the County Health Department, I would extend kudos to them for their involvement with us. And working on better aligning key stakeholders to institutionalize health equity into needs assessments and interventions. Mary.
Information and technology. Started out 2023 attending and participating in many of the related programs, which stands for Broadband Equity, Access, and Development Program. There were a number of sessions, meetings taking place to talk about what the government, state and federal government was going to do in terms of assisting, providing state assistance for to increase the level of access to broadband. They participated in those to determine how do we bring that, how do we, Peoria and Peoria County, how do we work through that in terms of those individuals who don't have access to. And we all know in this COVID, we found out that there were, in terms of the people who had access to internet and could afford it, it was huge. They also drafted a digital equity statement of rights saying that everyone should have access to the internet. We all understand and know when we talk about, I was looking at the computers, the internet and what it does in terms of nowadays for your health. Everyone wants you to go to my chart. Employment, they want you to fill an application out. So without that access to the internet, and we're talking about some people have access, but the speed is not high enough for them to be able to do the various things that they need to do. Thank you to the county received a grant. And so with that, they worked with the informational technology work group to talk about how do we use that grant money. And so what they're going to do is they're going to do an assessment to see how to access the Peoria area, how people to help those individuals who don't access that.
All right, let me talk about the justice system. And as an attorney, this is an area of particular interest to me. Please understand, and I think you all do, that the concept of equity and racial justice has many connections to the justice system, many ways that could be examined. So this group determined that that the first issue for our community was issues of child violence, and determined to take a look at that. And it reviewed various approaches to addressing child violence issues that came from any number of sources. There is deterrence, there is prevention, and there is looking at it from an epidemiological standpoint. That is to say, what are we doing to prevent child violence with the children of our community? In the end, this group decided that its work could be best spent in the epidemiological field. We have police to do deterrence, we have others to deal with prevention. But long-term prevention and addressing crises in the immediate term should be dealt with in line with the studies done by the CDC and related organizations. Again, they look at child violence epidemiologically and say what programs need to be in place to provide children the support they need to avoid getting into a violent cycle. So they began, after that, reviewing programming in the community to do an overlay of existing programming in the community against the CDC standards to determine where we had gaps in the community. That survey is taking place as we speak. That report, I hope, will be out by the end of the summer, and this group will at that point present to you in that regard. They also researched the efforts taking place in other communities. I can tell you that all this has led to interviews and meetings with the state's attorney's office, the police department, and others to get more information about child violence in our community. And it's led to two proposals, one of which I think you'll hear about next month. The Illinois statutes provide for the existence of a juvenile justice coordinating council. In the past, there has been one in the county, and I think that the county board was originally the agency that brought that about. It lost steam and stopped meeting during COVID for obvious reasons and hasn't reconstituted itself since then. It brings together all significant players in the field of juvenile justice to talk about the issues facing the community and solutions that might take place. We're calling for that coordinating council to be reestablished. There seems to be a lot of excitement and interest around this, a lot of motivation to get that done. I want to thank Scott. We've been dealing with Scott on this, and again, you'll see something, I think, in your materials for your next county board meeting, or next month's county board meeting in that regard. We're also looking at a youth treatment court proposal. Ours would be the design we're creating would be the first of its kind in the state. We're talking to the administrative office of Illinois courts in regard to that. It would modify the way that we address youth crime in our community and focus on the models that have been shown to be so successful in the drug treatment courts and in mental health courts and in veterans courts. I suspect you will see a proposal on that, if not next month, the month after that. Aaron?
Next is housing, and I always say quality housing. We have individuals that are housed, we have individuals that are unhoused, and some of those individuals that are housed, it's not quality housing. The housing work group has been working on researching what other communities are doing for best practices to develop strategies for implementation here in the Peoria and Peoria County area. They've identified some community organizations and agencies and leaders that they've been working with. One being Peoria Housing Authority. They've had them come and meet with them and then talk about what are the issues in terms of housing and affordable housing and people being able to have access to those. Also, the continuum of care, or the continuum, sorry, that looks at housing and unhoused individuals and how they're working to get those individuals housed. We've had it's not work. This particular work group has had some leadership challenges and changes, so some of the movement forward has not happened as quickly as we would like. But we're working again. In any organization, you have things that life happens, things happen, and people have to pivot and change what they're doing. And so we have to pivot and work on getting them back moving forward. But so one of the things is in some of our forms, we've done a survey with trying to determine what are the issues for housing for individuals. As we know, when you talk about housing, that crosses many sectors of our other work groups, in that if you don't have quality housing, then you have issues oftentimes with your health. You have issues with your getting to school, getting to work. So all of those work. So one of the things that they're looking at in 2024 is working with other work groups, some of our other work groups, to assist them in their efforts as well as to have them assist them in their efforts.
Next is Child and Youth Development. This group has been addressing concerns regarding school preparedness and advancement. And they began with some strong work looking at issues within the schools, but they've kind of refocused their efforts due to a change of leadership and contacts with the collaboration with District 150. And what they feel they should be directing their attention to primarily is kindergarten preparedness. We found that in our community, children from lower income neighborhoods, primarily, when they go to the first day of kindergarten, they are woefully unprepared compared to where they should be. And so they are working on a collaboration with Peoria Public Schools and the Regional Office of Education, or they want to collaborate with Peoria Public Schools and the Regional Office of Education, together with other schools in the county, to address a more comprehensive program of kindergarten preparedness throughout the community. Again, this was a committee that had some challenges in leadership, but seems to be on a path now that at least the steering committee feels is quite positive.
Transportation and mobility. In our last report, one of the things that we noted was in the 61605, all of the 61600 areas, 50% of the individuals did not own a car. I know that every morning when I get up and I go in the garage and I start the car up and pull out the garage, I'm able to get to where I need to get to. And I'm not having to wait on anyone or any mode of transportation to get me to that, from point A to point B. Well, those individuals, that's a challenge for them. And again, when you talk about lack of transportation, you talk about lack of mobility, being able to, and if you're in an area where you are retail, not only food desert, but retail desert and health desert to some degree, that presents an issue. And again, we can't say it over and over again, how these all interrelate and how they all compound in terms of the issues, in terms of disparities. Talking about not being able to get to work, and we talked about that with the pilot program through the Economic Development of Jobs work through. Not being able to get to work, or where you're able to get to work, you may not be able to get in some of those outlying areas where you're able to make a living wage income. So then that can dictate where you live, dictates a number of things. So the Transportation Committee has been researching national and regional in terms of how those different areas are going about and dealing with the transportation issue that many individuals who come from low income households are able to then remove that barrier for them so that they can get to where they need to. They work with the Tri-County Regional Planning Commission as well as Peoria County to again look at and to uncover the transportation. There was a study done by the Tri-County Regional Planning Commission looking at transportation in the Peoria and outlying areas. So looking at that to see what are some of the strategies that we can develop and make recommendations to remove those barriers as it relates to individuals with those barriers. Uh, we've had some issues with leaders, not issues, but some leadership in terms of individuals having to not to move on. So some of that movement with this particular work group has not happened at the levels that we would like, but we're working with those who are still there to try and see how we can move that forward. One of the things that they're going to do is they're going to work with the Economic Development and Jobs Committee on that transportation pilot.
So overall, we would say that 2023 was a mixed year but a good year for the commission. Much work was done and progress was made in numerous areas, but frankly, we can make progress in other areas and need to make progress in other areas, the ones that were mentioned. Groundwork was laid for progress. We think that it will be achieved in 2024. You've already heard that some of the programs, two pilot programs are underway, and we're working on some issues in the justice area and others that we've planned or that we believe will bear fruit by the end of summer, if not then by the end of the year. The strengths that bring this project to where it is, I would say are several. First of all, the enormity of the issue. I don't think it's lost on anybody in our community that the issue of race and the vestiges of our history have left a huge problem in our country, a huge issue that many people want to see addressed. Most people, I would hope, want to see addressed. And the sheer enormity of that task, I think, makes it attractive to people in the sense that they feel that something must be done. And I sense a desire in our community to see progress in this area. I do in part because every month we continue to see new volunteers join us. Now, we have talented volunteers without question, but we have no staff. And so when I say we have talented volunteers, it's just that. They are volunteers. And so if they have big issues that come up at work, they have big issues that come up with their family, those are issues, or in their own health, those are things they need to address first. And we tell them you need to address that first. And so we do juggle a bit with people who are, as Mary said, are facing various challenges and come in and out. We're not asking you to provide us with staff. We understand the charge that we were given, and we welcome that challenge. But sometimes it does make for a situation we have to address. Fortunately, within our community, we have a lot of community resources and organizations that are addressed issues that at least are cousins to the ones that we deal with, and we believe in collaboration and working with them. And finally, I've said this earlier today, and I want to say it again, we're fortunate that we have two committed governments here to what we're doing. The city and county have been marvelous to work with in the past couple of years, whether it's Scott or Patrick or Jim and Rita, have been delightful people to work with, and have been responsive to whenever we've called. Andre here and Melody over at the city have just been outstanding. So, Mary?
Someone made a comment earlier about Chairman Dillon looking mean. Sorry. and that's exactly what this is. It's a serious issue. And we've had some challenges. I tend to think that I speak loud enough for people to hear me, but that's not always the case. Thank you, Tim. We've had some challenges. One of the challenges is we said it was one of the strengths, the enormity. But the other part is the complexity of this. I was having a conversation. We had our second orientation, and that's part of what we've implemented in terms of structure. We had our second orientation informational that people can click on the website, on the county website, and say that they want to participate in the orientation informational session. And so a gentleman said on that he was talking about these issues were, he was passionate about them, and it basically he had some answers. And I told him that was wonderful, and we definitely need him on, but also understanding that these are systematic, these are systemic issues, and that we could come up with and we could say we're going to do this, this, that, and the other without having done the research, both from the qualitative standpoint and the quantitative standpoint, talking to the individuals that are being impacted, those who are not being impacted and what they're seeing. We could do that, and we could come up with some things. But does that deal with it from a systematic standpoint? And that's where the complexities are. Some people have been not as happy about the progress, but we believe in its progress is about movement, and we have made movement. It's not about getting to the end because it's not a race, but it's about making movement toward the goals. So, and some of those individuals have decided that is not a fit for them because we're not moving fast enough. Sometimes we have those moments where we're looking like we could be doing more. But when we sit down and we look at the gravity of the issue and what we've done and what we've made movement, we've made strides. The fact that commissioners are volunteers, so when people can't make meetings, they have other things come up, or they have a life, and so it sometimes is not allowed them to continue to participate. And then the turf issues. I say oftentimes, all the time, that we as Peoria County, we are resource rich, but we are collaboration poor, and that we don't always collaborate. And so being able to get some information, being able to come together with different groups and talk about how do we work on these issues are not always as easy as we think that it should be. So those are some of the things, some of the challenges. But as I said, progress is about movement, and that is what we've been making movement. We've been making strides. And what's most important is the fact that the city and the county came together and said that this is an issue for our community. And when I say community, I'm not talking about dividing up into zip codes. I'm not talking about rural versus city. This is our community. Peoria County is our community. And we are working to make it a better place for all. With that is our report. You have the more detail, but we wanted to just give a high level of what's been happening. And we want to open it up for questions, comments, random or not.
Member Ricker.
Well, first off, thank you for the work and the report. Progress is always a journey. One of the things I typically like to look at is, are there other communities in the country that are on a similar journey where we can collaborate with others, see what they've learned, see maybe bumps that they've stumbled into or things they've done. So maybe you could articulate, what have we done with other communities that likewise are doing a similar journey?
That's a great question, and the answer is that we do encourage our subcommittees, our work groups, to take a look at what other communities are doing in their particular area. Perhaps the best known is King County in Seattle. It frankly took about 7 years to get motion moving at any decent pace there. And they developed a little bit different structure than what we've utilized, but we've spoken to them on a number of occasions, got some ideas for how they're moving forward and the like. Madison, Wisconsin is another community that has embraced approaches similar to ours. St. Louis has. Now I forgot the name of the city.
From Winnebago.
Winnebago Winnebago County has done some stuff in Rockford. They've done some stuff regarding youth. The point is that yes, your answer is exactly right. You're on the right path, and we have tried to communicate with Tacoma is another one. I mean, we've spoken with a number of communities, and there's one. This is my age catching up to me. I hate to say, although I don't think I'm as old as Dan Kelch, but oh, he left. Darn it! I wish it'd remind me. And Danny, tell him I said that if you would. There's a community. It's right on the Illinois River opposite Galena. What's the city I'm after here? It's in Iowa. Dubuque, yeah. Dubuque has done some things too, interestingly enough. We are, Steve, the questions you've raised are good ones, and we do try to communicate with as many communities as we can about this. Evanston's another. I mean, I can continue to go around. Washington, D.C. has done some things too. So we try to see what they're doing. We try to determine how that would apply within the particular circumstances of our community and do it. I've repeatedly said that to people, as has Mary, that the questions sometimes will be posed when we make recommendations for programming and the like is, are there other people that are doing this? What has been their success or the lack of success? So thank you for raising that.
And I would add that finding a community that mirrors Peoria County sometimes can be a challenge. And so what they may have been successful in implementing may not fare as well here based on economics and some other demographic setup, you name it. So, and this was also, the commission itself was mirrored off King County in terms of our setting.
Yeah, and I appreciate your comments, Mary, on, every community, I'll say, has its own personality. What drives its economy, what drives its history. So I don't anticipate we will find a community that looks like Peoria and it's just the same. Mm-hmm. But there's probably aspects from various communities say, okay, their justice system did this, their housing organization did that, that worked really well. Each of these elements, you might pull an element from Dubuque and you might pull one from, Tacoma or wherever. But again, it's not easy to do. I get that. So if the subcommittees or the work groups are leaning on that, great. I just, as you mentioned in Seattle, they've taken 6-7 years on the journey ahead of us. I'd like to use that journey and instead of 6-7 years, make it 2 or 3 years or 4 years for us.
And in actuality, where we are now, it took them 7 years to get to where we are now. When we started this journey, we called them up and had a conversation with them in terms of what's been your best practices, what has been some of your challenges. And one of the things that they said, and that's what you saw in our first report, they said you have to gather the data. You have to gather the data and show, because people will say, not in my town, not in my city, this is not happening. And so that was the first thing that we did. And one of the things that they've done is they've created an office. And they started out with one person, now I think they have about 20 people. That this is what they do. And they do it across the governmental agencies. They've also, and we're working on that and getting a representative from the city and from the county for our various work groups, individuals that have that knowledge and information, that's their position, so that they can provide those work groups with information, whether they're gathering from us or gathering from other areas, because we all know when you go places, you network with people. And so that's some of the other things that we are doing. So we're moving. But again, all of this, it takes time. It took time to get us to where we are. It's going to take time to move to get to where we want to go.
Any other questions? Mary and Tim, as always, very appreciative of all the time and effort you've put into this and your leadership on that. It's amazing what you've done so far. So thank you.
Appreciate it.
Thank you for your support.
By the way, anytime anybody has questions, it doesn't have to be in this setting. Just send us an email if you have a question or give us a call. All right? Thank you.
Thank you. Have a good session.
Next, we have resolution bid 30-2 -23 community kitchen equipment. Is there a motion to put this on the floor? Member Blair, Member Phelan.
All right, thank you, Mr. Chairman. Just point of information to begin with, or to start off with, this is coming before this committee because of the funding source. Typically, this probably would have come to Mr. Renault's committee as it's related to the Health and Human Services building project. So included in the furniture, fixtures, and equipment budget line item in the total project budget that you have already approved, and included in the ARPA allocation that for this project that you've already appropriated were funds for the community kitchen build out. Those got spec'd. The actual value of this equipment is greater than my spending authority, so that's why it went out for a competitive bid. The low bid that was received for all of the equipment is from Johnson Mechanical Service that and includes a dollar value of $27,107. This, as a reminder, the community kitchen is used for food safety training, healthy food and nutrition demonstrations for the WIC clinic and U of I extension, and has the potential to be used for entrepreneurs seeking a licensed kitchen for their food prep. Went through the bid process. The recommendation, as I said, is from Johnson Mechanical Services, and the source of funds is ARPA in terms of how we're going to pay for it, but those dollars are already appropriated in spending authority, and they're already included in the project budget under the furniture, fixtures, and equipment line item. Happy to try and answer any questions.
Any questions? Seeing none, all those in favor? Aye. Aye. All those opposed? Ayes have it. Next, I'm going to move some things around for the sake of some visitors that we have. We're going to do discussion after we come out of executive session. So, is there a motion to go into executive session for purchase of or lease of real property? Member Williams, Member Allison. Any comments? All those in favor? Aye. All those opposed?
Aye.
Ayes have it.